Before we begin today's video, let's practice a bit of mindfulness. Firstly, look at the screen, then slowly close your eyes. And as you do, just leave your mind blank. Then, take in a deep breath through the nose slowly, then out through the mouth. One more time, in through the nose and out through the mouth. And one last one. Now slowly open your eyes and let's begin today's video.
In today's video, we are going to be talking about the hand's anatomy, illnesses, and when I mean illnesses, specifically common illnesses, as well as rare illnesses, as we've done for almost all of our videos, if not all of our videos. The parts listed on screen today are all the parts of the hand I'm going to be talking about for the hand's anatomy. The bone. There are three major types of bones in the hand itself, including the phalanges, metacarpal bones, and the carpal bones. The phalanges. The phalanges are the 14 bones that are found in the fingers of each hand and also on the toes of each foot. Each finger has 3 phalanges, the distal, middle, and proximal. The thumb only has 2 phalanges. The metacarpal bones. The metacarpal bones are the bones, specifically 5 bones, that compose the middle part of the hand. The carpal bones. The carpal bones are the 8 bones that create the wrist. The 2 rows of carpal bones are connected to the 2 bones of the arm, the ulna bone and the radius bone. We usually break it down in parts in past videos when we're talking about each part of the anatomy of any part of the body, but for this video I'm just gonna put it all together, or group it all together as one. Numerous muscles, ligaments, tendons, and sheaths can be found within the hand. The muscles are the structures that contract, allowing movement of the bones in the hand. The ligaments are fibrous tissues that help bind together the joints in the hand. And the sheaths are tubular structures that surround part of the fingers. The tendons connect muscles in the arm or hand to the bone to allow movement. In addition, there are arteries, veins, and nerves within the hand that provide blood flow and sensation to the hand and fingers. I hope it was easy to understand the anatomy, especially with the new change I did when I grouped everything together. And in addition to that, sorry for the repetition of photos, but that photo really showed like the sheaths and ligaments and muscles and almost everything I was talking about for the last part of the hand's anatomy. So I hope you understand the anatomy. After this, thank you. In addition to this, just a little disclaimer that every word in this video I might not pronounce to the accurate amount. So if you want to pronounce it for like when you're pronouncing it later on in life, just like check the pronunciation just to make sure and be sure.
At the start of the video, I mentioned I was going to be talking about hand illnesses, but in addition to that, I'll also talk about hand injuries for both the rare and common sections of hand injuries and illnesses of this video. I hope this clarifies why it also says hand injuries in the title of this chapter and why it's going to say that for the next chapter as well. So let's get back to the video. We're going to divide the common injuries and common illnesses of the hand into 2 sections, the common injuries and the common illnesses. So first we're going to start with the common injuries. Fractures. A hand fracture is a break in one of the bones in the hand. This can include the small bones of the fingers, known as the phalanges, and also the long bones within the palm, known as the metacarpals. Dislocations. Dislocations occur when the bones in the hand or fingers are displaced from their normal position, often due to a sudden impact or twist in motion. Sprains. Sprains occur when the ligaments in the hand or fingers are stretched or torn, usually from a sudden injury or overstretching. Cuts and lacerations. Cuts and lacerations are deep cuts or tears in the skin of the hand caused by sharp objects, which can also damage underlying tissues and nerves. Secondly, we're going to talk about common hand illnesses. Carpal tunnel syndrome. Carpal tunnel syndrome is a condition caused by compression of the median nerve in the wrist, leading to symptoms like numbness, tingling, and weakness in the hand. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder that causes inflammation in the joints, including those in the hands, leading to pain, swelling, and deformities. Osteoarthritis. Osteoarthritis is a degenerative joint disease that affects the hand joints, causing pain, stiffness, and reduced range of motion. Dupuytren's contracture. Dupuytren's contracture is a condition where the connective tissue in the palm thickens and forms nodules and cords, leading to the gradual bending of fingers toward the palm. As probably seen in the title, we're going to be talking about rare hand injuries and rare hand illnesses in this chapter of this video. We're going to begin with rare hand injuries. Complex regional pain syndrome, or CRPS for short. CRPS is a chronic pain condition that often follows an injury. It involves severe persistent pain that is disproportionate to the initial injury and can be accompanied by changes in skin color, temperature, and swelling. Fingertip amputation. While not extremely rare, fingertip amputations, especially those involving complex reconstructive needs or prosthetics, can be less common compared to other types of hand injuries. Extensor tendon laceration. This occurs when the tendons that extend the fingers are cut, usually requiring intricate surgical repair and rehabilitation. It's less common than flexor tendon injuries. Hand fracture with avulsion. An avulsion fracture happens when a fragment of bone is pulled away by a tendon or ligament. This can be rare and often involves specialized treatments. We're now going to talk about rare hand illnesses. Scleroderma. Scleroderma is a rare autoimmune condition that causes hardening and tightening of the skin and connective tissues. When it affects the hands, it can lead to skin changes, joint stiffness, and impaired hand function. Ehlers-Danlos syndrome, or EDS for short. EDS is a group of connective tissue disorders that can affect the skin, joints, and blood vessels. In the hands, it can lead to hypermobility, easy bruising, and fragile skin. Kienbock's disease. Kienbock's disease is a rare condition where the blood supply to one of the wrist bones, the lunate, is interrupted, leading to bone death and deterioration. It can cause wrist pain and limited mobility. Hand, foot, and mouth disease, or HFMD for short. Although more commonly seen in children, this viral illness can cause rashes and sores on the hands and feet, and can occasionally affect adults, leading to hand symptoms. Nail patella syndrome. Nail patella syndrome is a genetic disorder that can lead to abnormalities in the nails and patella, kneecaps, as well as potential hand deformities and joint issues. These conditions are less common and might require specialized medical attention. If you or someone you know is experiencing symptoms related to these rare conditions, consulting with a healthcare professional or specialist is important for proper diagnosis and treatment. We have now reached the end of today's video, and with that, I would like to give you a big thank you for watching today's video and watching all to the end. And since you already watched to the end, you might as well just hit the like and subscribe button, because it really helps me out a lot and I would really appreciate it. Thank you for watching. Have a great day.